Kara Youngblood with us this evening. Kara is one of our counselors as well, and she did her internship with us and is now hired and doing clients and has a lot of expertise in a lot of different areas. So we're very glad to have Kara join us this evening. We do want to try to get through the bulk of the material tonight and present that to you, and then definitely want time for question and answering at the end so that you can have an opportunity to join in and have those questions answered the best we can this evening. I do have to make a little bit of an apology for myself. I was in an accident about a year ago, and my throat, for some reason or another, every now and then just gets clammed up, and I have a little difficulty talking. So bear with me if I'm having to clear my throat a little bit more than I'd like to this evening. So we're here tonight because some of you may have a family member. You may be also a friend to, perhaps you're a teacher or a professional in some other area that you have to work in some way or another with individuals who have the diagnosis or have behaviors that are similar to attention deficit disorder. For our purposes tonight, most of the time I'll be talking about ADHD and an ADD format, because I sometimes have trouble getting that H in it, forgive me. It used to be where it was broken down to attention deficit disorder with maybe an impairment to and being inattentive. Now, since the DSM-5, which is the diagnostic Bible that we go through to diagnose, it's now considered ADHD and has criteria to diagnose under that. So I might go back and forth. We're pretty much talking about the same thing as we go along. So tonight we want to try to accomplish a few things. We want to define ADD, HD, and we want to help you to know if you're having symptoms, is that really what it is, and what is different between some symptoms and maybe other disorders that might mimic ADD. And so we're going to clarify that tonight. We want to understand the person that has this deficit and look at this from a very positive perspective, and knowing that there's hope and they are able to be helped and they can have a very successful life. We want to talk about things that we need to avoid for the individual, as well as the absolutes that are necessary to relate, as well as to teach and to help children, and even all the way up into adult working situations. We want to give some behavioral principles to work with, and certainly we want to have opportunity to look at facts and your questions that put forward to us tonight. So as we begin to talk about ADD, we want to understand that it is not something that you contract. It's not something that just happens out of the blue. It's not from eating too much sugar or too much red dye. But literally, it is something that is a neurological deficit. And when we say neurological deficit, what that means is that something in the brain, from the way that information comes into the brain and the information goes out, there's a deficit there. And so we call that a neurological disorder. It's not psychological, although it has psychological difficulties that go along with it as a side effect. So a neurological disorder looks something like this. If you can imagine the front of your brain, and right here we call this the frontal cortex, and information comes into your brain. It's kind of like the eyes to your brain. And so everything that comes in has to be processed in some way. As that information is coming into the brain and is processed, then there's going to be output. So a person who is not suffering from the deficit of ADD would be able to say, well, what came in, I'm going to think about it, I'm going to process it, and then I'm going to act accordingly. So think of a day like we had recently. Beautiful weather, crystal clear skies, warm. It just kind of makes you feel like, hey, I want to get outside and go have a good time. But perhaps you have responsibilities that you have to get done. And so therefore, when you are in that position to clean your house, clean your car, pay bills, whatever it may be, even though it's a beautiful day, you may not be able to go do that because these obligations have to be prioritized in your life. Now, if it's a situation where I do have ADD, my impulse is, oh, I'll do it tomorrow, or I'll do it later. I'll save it for a rainy day. It's not really that important anyway, when in fact it may be very important. So we look at the neurological perspectives that are very, very complex, and I've given you a very skinny surface, and you point out that. But just think of it as the ice in my brain has to go through a processing system. In that processing system, then I should have an output that is demanded to the circumstance. So if you're a teacher and you're giving your students a quiz, you're expecting that child, for example, being an elementary level, is given a piece of paper, number your paper 1 to 5, and a non-ADD person would organize themselves in such a way to do 1, 2, 3, 4, 5. An ADD individual may say, oh yeah, I'm supposed to do that, but over here, I got distracted because a bird flew by the window, and I'm watching that bird, and the quiz is supposed to be going on, and so understandably, that child now is behind because the command was to order your paper 1 through 5, and that didn't happen. So it is a challenge for the student who is perhaps very smart, and who has the ability to write the numbers 1 through 5, but unfortunately, because of the deficit, they got distracted, and it makes them look like in some way there's something wrong with them. Now, we hope to talk about that tonight in such a way that you can say, yeah, that makes sense, I understand that, and what is that like for that person who suffers from that, and what is it like when you're trying to teach or trying to guide a child, or an adolescent, an adult even, in a workplace, trying to get them to be able to do the tasks that they're called to do. So we're going to try to sum that up, and all attention deficit disorder, hyperactive or inattentive, have a neurological deficit. And the way that we will diagnose that is not just by having a one-time sit-down, but it involves a team of people that help us to put that all together. We'll talk about that as we go along here tonight. It is one of the most common disorders in children, and we want to make sure that we understand from a diagnostic perspective that by the age of 7, a child would have some indication that there's a deficit there in being inattentive or hyperactive. In order for it to be true and even diagnosing into adulthood, a lot of history has to come together to understand exactly what's going on in that person's life. So ADD, ADHD is a neurological deficit. It is possibly genetic. It's possibly something that has happened through maybe even birthing. Perhaps there wasn't enough oxygen to the brain. It's possible that through a head injury, a closed head injury, that there could be a deficit that has appeared as a symptom or an outcome from that injury. So stroke victims, as well as people who have injuries, genetic, that all fits into that perspective of the neurological possibilities. So we know now just a little bit. Of course, we need to move on, but we want to make sure that we understand that it's a deficit that goes through the lifespan. It's not something like I get it and then all of a sudden it's gone. Now we'll talk as we go along today that there are things that happen and occur along the way that hyperactivity decreases. Some of the coping strategies and skills that you've had as a person, you've learned how to manage around that. And even perhaps there's been the skill sets that have been taught with perhaps some teacher, parent, tutor, whomever has really helped that individual young in life, that they've been able to learn how to manage. Often I have particularly young men who come in about their sophomore year, junior year of high school, and they have been able to walk in the room, take the test, get the grade, and move on. Now all of a sudden in their math classes, particularly those that call for a lot more detail, like algebra, algebra 2, and so forth, those memorization skills, those ability to walk into class and just do it, it's not working anymore because more is demanded of that individual to be able to get that work done. So often when I see college students, high school students, they're like, I don't know why this has been being a problem, why I have to be here, I'm fine and fine and fine. But really, the truth of the matter is, it's been there all along, that they've been able to cope and manage through some skills like memorization, for example, or that their brain is so good that they're able just to look at something like the book, or a page in the book, and they get it right away. So their strategy is often memorize and go by memory, and until that no longer works, then we're in trouble. So we want to look at that now, and Kara's going to come up and talk a little bit about how it works over time and how it affects different children, adolescents, and adults.
All right, good evening. So now we're going to take a look at what we describe as some of the comorbid diagnoses that are often found go along with someone who has a ADHD diagnosis. Now, one of the things that I'd like to bring to your attention is that often, as Rich was just talking about, individuals that have the ability to cope in their younger years and then come into the office and all of a sudden are uncertain as to why their things seem to be unraveling, is that in adults, what I have been noticing is that the other diagnoses tend to mask ADHD diagnosis. For instance, someone may come into the office whose complaint is obsessive compulsive disorder, or someone who is having difficulty with an eating disorder, particularly young women who find themselves meeting the criteria for binge eating, things of that nature that are masking an ADHD disorder. So we take a look here at, we have alcohol and substance abuse, anxiety, depression, learning disabilities, and social and emotional delays, all of which are often disorders that go along with the attention deficit disorder. And I might add that, as Rich was explaining earlier, that I myself, someone who had I experienced several years ago, and brain trauma, traumatic brain injury. And so as he was indicating, that it's something that I did not experience up until that point in time. And I've noticed that, even as individuals are walking in the room, that I myself find myself quite distracted by those external stimuli, or the sound of a clock ticking in a room that I would have been able to, prior to that brain injury, be able to filter out, and now it becomes somewhat problematic. So we move on here to some of the symptoms. I love this picture. I want to draw our attention to this picture that my colleague found for this presentation, because when I take a look at this, immediately I was struck by her intensity. And the first thing that comes to my mind is that oftentimes with the diagnosis of ADHD, there's like an internal intensity that's going on within the individual that sometimes we demonstrate, and other times it's just something that we, on the other hand, have difficulty expressing in productive ways, which then comes out in other ways such as anxiety disorders and depression and those types of things. So here we have behavioral issues, disorganization, hyperactivity. I think about this little girl here, the impulsivity that it must have taken for her to jump up on top of the car, who knows, in the middle of the street perhaps, and start washing out window. Distractibility, again, I mentioned, the distractibility component that goes along with this. Inability to focus and sustain attention, and relational difficulties. Oftentimes I see that clients, and perhaps Rich does as well, come in because they're having difficulty in relationships, and in their 20s and 30s, and they're not sure why. And it would look like things such as my significant other complains that I often interrupt his or her sentences. Don't permit them to finish what they were saying before I'm jumping into what it is that I want to say. Things such as inattentiveness. Individuals will say in their relationships that their significant other complains that they're just not attentive to their needs. And also difficulty with following through. Perhaps they made a promise about something and they totally intended to follow through on it, and they find that they often are not able to do that. So these are some of the symptoms that we see.
So may I add into that just real quickly that before we go to the next slide, these we look at and we say these are problems, these are symptoms in some way or another. Well, we don't want to give ADD or ADHD a bad rap here, because on the other side of this are many, many, many wonderful characteristics and qualities. Some of our most talented people, artists, poets, musicians, surgeons, lawyers, across the board. It doesn't mean that there's a curse on your life, but there's some very, very wonderful skills that they can use because of the hyperactivity, because of the fact that they can sometimes hyper-focus on things and do some minute details that otherwise, let's say, a non-ADD individual may not be able to experience and complete. So it's important that we recognize, again, as it looks negative, there's also many positives, and we don't want to forget the person as we're talking about these things, because they are, in the end, they are gifted and talented and very capable in many ways. But when it's a deficit, I like to present it as what a gentleman by the name of Dr. Colin Ross suggests, that a disorder is not a disorder until it disorders your life. So think of that. So we all have inattentiveness at times. We all have hyperactivity at some point in time. We all can be responsible for procrastinating at some of the time. But as long as that is not prolonged and a continuum where it's interrupting, interfering in our lives, then of course that's not a deficit. So a deficit or a disorder is a disorder when it disorders your life.
Okay, if you would picture a big city, an intersection with lots of cars, buses, noises taking place, something like we don't particularly have here around in our area in Marion County, but a rather large city. And now imagine the sense of perhaps confusion. I've been to some really, like take Chicago for instance, the confusion that I feel momentarily in that type of environment. Individuals with ADHD, unlike those who don't have this disorder, often can filter out the input, like all of that that's going on in that example of a large city. And they can concentrate on the reason why they went to that city. Maybe it was to, check out a restaurant they've never been to, or go buy a purse, or who knows what, right? And they're able to kind of, we're taking a look at input here, the visual, auditory, and tactile. So in that environment, there's a lot going on visually, auditorily, and also, in some respects, tactile as well. However, for the person with ADHD, having difficulty filtering that out, on the output side then, it can become problematic and overwhelming to some extent. Now imagine you have a filing cabinet. Most of us have a filing cabinet or have seen a filing cabinet, and you have lots and lots of folders that you've been asked to file. Say you get a file, for instance, that's the sound of a bus, and you want to put that in the designated folder designed for the sound of a bus. Along comes your, across your desk again, the same file, the sound of a bus. Someone without ADHD, they're going to go, I already have that file, right? And they're gonna set it aside, or perhaps discard it into the trash because they've already got that in their folder. On the other hand, someone with ADHD may not then set that aside or put that in the trash. They're going to file that again. And so what ends up happening is many times that they're continuously filing the input. That's what we want to understand from this slide. And you're getting input so many multiple times that it begins to affect our output. So we're having difficulty, as we can see sometimes, of not being able to focus, for instance, because of the different input that we're unable to set aside. I've already filed that as important. Now I can focus on something else. I can focus on another file folder of, the sound of something else, or the feel of something else, and so on. So that's kind of my take on this slide. How about you, Richard? Do you have
No, you did great. And the important thing that we want to look at is we're looking for that output. What's right for the situation, what will be the appropriate emotion, how should I be able to handle my behavior and my conduct. And again, school teachers who work with this, every day are saying the problem with Johnny is Johnny continues to act inappropriate or has inappropriate responses when in fact he's really capable of making good responses and behave well, sit, stand, keep your hands to yourself, don't harm other people and that kind of thing. But for whatever reason, that behavior is not matching what's coming in. I'd like to also point out the tactile perspective for just a moment. Years ago, I had the privilege of being trained under John Taylor, who was out of Seattle, and this is way back in the early 90s. And one of the very important things that I think are critical to understanding in ADD individuals, children and adults alike, are things that you probably are going to get like, okay, yeah, I understand that. Oh, really? That's true? Think about seams on your socks, labels in the back of your shirt, things that are too tight or things that are too loose. What's on your tongue, how that food feels to your tongue. And many ADD individuals, children who are more hyper in nature, but not all, tend to have a very difficult time eating because the texture feels really, really uncomfortable to them, and therefore they Now, medications get factored into that too if they're being treated with medications, but the important thing is what's going to feel. So how I feel when I eat, what my clothes feel like on my body, how my sheets feel in my bed. All those kind of things are really critical in understanding that core concept of what's coming into me, how I think, feel, how I behave. That all is very, very critical to the child. So a real quick tip, if you have someone that is really, really struggling with anxiety, struggling with attentiveness and so forth, take the silk off of the blanket on the binding, cut that in about a 2-inch square, and give that to the individual. Yes, adults can do this. And just put it in your pocket and come back to it. And just a calming factor comes through that silk. It's really, really interesting to watch kids. A comb, a fine-tuned comb, just combing the hair on your arm, for example, can be very, very, very calming and very soothing to even the back of your neck. There's all kinds of different tactile things, which is really the feeling. What do I experience with the things I wear, the environment around me plays a very, very big factor in how that child or individual behaves. So that's just a brief one for our time. So we want to go into some key factors. We won't spend a lot of time with this. Again, tonight we're trying to identify the difference between what's inattentive and what's hyperactive, excuse me. And when we go to our child or individuals brought to us to try to figure that out, what's going on, these are the diagnostic codes that said if you had 3 or 4 of these symptoms, then that gives us a clue into a diagnostic of inattentive ADHD. So obviously the one that gets the most attention is paying attention to details, trouble sustaining attention, keeping that. Like when you go to read, you read that sentence or two, and you're asked, well, what is said in those sentences? I don't know. And you have to go back and read it and reread it and so forth. So it's hard to sustain attention, but it's also sometimes a retention issue as well. Doesn't seem to be listening when spoken to. How many times does that come up either in the classroom or at home or even on the job as well? Fails to follow through instructions, fails to finish schoolwork or chores. Again, many hours of discussion we could have around that and the aggravation that causes for mom and dad. Also, being able to get organized. I can't tell you how many times I've heard, and I say that really respectfully because I feel for these kids who work on their homework. It's a battle to get that work done, and it doesn't get to school because it didn't get in the backpack, or it's there, but I just can't find it. Many times said. Avoids or dislikes doing things that require sustained focus or thinking. We'll put that in the category of boredom. Many ADD, inattentive type, even hyperactive people struggle with boredom. And boredom simply means, in this case, what should be interesting quickly loses its ability to sustain attention. And if we had more time to go into the brain anatomy and so forth, that really kind of puts us in the limbic system of the brain, because there we get the kind of the emotion and the reward and that kind of thing. What good is it doing you to sit here and do this task, because it doesn't seem to bring any reward? So it quickly is discarded because it brings nothing of interest or reward to me, so I want to move on. Now we could get on a real hobby horse here and say that, well, this is where the games come into play, and why isn't it my child or spouse or whoever can spend hours on the game given a simple task for washing the dishes or something like that, and they can't get it done, or it takes them forever to do it, because there are some things that do get attention, and you're able to sustain it and keep it because it's getting a reward back. And that boredom factor then goes away. But it's a real challenge to deal with that aspect of it. Obviously, losing keys, easily distracted, and so forth. So we want to say this probably over and over and over again. Not everybody who has these symptoms are necessarily ADD. They can also have these symptoms either way, with depression, anxiety, bipolar, and other disorders can also fit into that criteria for diagnosis. And now let's look at the hyperactivity person who has just this real difficulty keeping himself or herself in the seat, doing what they need to do without stopping or pardon me, my brain just keeps doing this to me tonight. Stomping their feet or a pencil or doing something that they have to keep moving. That isn't because necessarily they want to be a problem, but again, we go back to the brain anatomy here and we say that there's something in the brain through the chemistry, dopamine and norepinephrine. As they speak to the brain, what happens is there's either too much or there's too little. And norepinephrine is very important because it helps bring the calm. So Vision, if you were with me, it's a beautiful day like yesterday. It's warm. You're sitting on the beach. Everything is lovely, right? But the hyperactive person may not be able to sit there and enjoy that because they have to be running, jumping in the water, building sandcastles, whatever it may be, because sitting there is just something that the brain will not allow them to do. So it's not because they're bad, it's not because there's some demon in them, it's simply because the way the brain anatomy works, you have somewhat of a short circuitry going on there that in chemistry and norepinephrine dopamine, that they're not balanced. So usually the child who has this particularly can grow out of it usually by puberty. That seems to dissipate with new hormones going to work and so forth. Now, if you're an adult and you're here tonight because you say, maybe I have hyperactivity, it doesn't mean that you don't get hyper as an adult, but it's not near the problem as it is in childhood unless you have a very severe case of ADD. So, looking at that further, these are just things that we see happening often in children, but in the office, you might see some of that kind of behavior in this way. That person acts as though they're on the go. If you're working an assembly line and this, guy next to you, he is just pumping out the parts and he's just like going like a madman. How in the world does he have that energy to sustain that? So, it's kind of like as if they're driven by a motor and they just keep going. Some to try to eliminate the boredom, big part of that. The other part is, again, what's going on in the brain chemistry. Now, if I got another, let's say, high horse, this is where the different concerns come along, particularly for our adolescent clients in individuals and adults. This is where drugs, substance use really comes in strong because the individual is not able to lay down in their bed and go to sleep. The problem is the brain is running like a madman, and it's just going. And trying to get that to calm down is near impossible. It's 3 a.m., I gotta be up at 6 a.m., and I'm just only getting 3 hours of sleep. And one of the critical things that we see, and very, very passionate to say this, how difficult it is to function when you're getting only 2 and 3 hours of sleep. So this hyperactivity part, if it didn't subside in puberty and continues into our adolescent years, 17 all the way through 22, 24, something like that, you can really be very chronic, and why we would see a high level of depression at that level. So these are some things that are happening with our diagnostic piece. So we just want you to know that these are things that are being looked at. You may not have every characteristic or symptom, but it takes a lot of time to sit down and really understand, again, history, what medically is going on, in your family. Is this a genetic thing? Again, is it a brain injury, stroke, or something like that that has created some of these symptoms in ADD? We also are very careful to make sure that we understand what has already been said as comorbid or co-occurring. It's possible that you can have ADD at the core, you can have anxiety, you have depression, and you can have other symptoms like OCD or other complicated problems. So it's really, really complex, and you almost have to ask, well, what came first? Depression and then ADD, or vice versa? Always we look at the neurological perspective, what's going on there first, because what's going on in the brain is most important. And that's why we need to have a doctor involved in making this diagnosis, because the doctor has to look through every medical component and make sure there's no tumors or other problems in brain function, so that they can go ahead and make an appropriate diagnosis.
And here, I'd just like to take a moment to maybe by raise a hand. How many of us have experienced at least one of these thoughts or feelings that's listed here? Perhaps all of us, right? I know I have. And I think this goes back to something that my colleague was talking about earlier, that we don't want to leave this presentation with the idea that someone with this diagnosis, that it's a necessarily a negative thing, because what I like to do is normalize when I have a client, particularly an adolescent come into my office that's being evaluated for ADHD. They often come in with feelings of really low self-esteem, failure to perform and meet the expectations of their parents, their teachers, perhaps even their own expectations. So to be able to normalize the thoughts and feelings that we experience when we have this diagnosis is, I think, an important component, because it's just as if to say, you're not the only one who experiences thoughts and feelings of this nature. And the more that we can normalize the thoughts and feelings that individuals have, whether that's normalize them and you're the parent and you normalize those, or the teacher or so on, then the more that more likely they're going to be able to feel like there's not an outcast within their environment.
So that leads us into the perspective, I hope you grasp, that ADD, ADHD is not just only a medical, neurological disorder, it also has a psychological impact. That's very, very important to understand that most people who struggle with this do really, really have a lot of work to feel accepted, to feel the light to be part of, and particularly as we go into the college years, believe it or not, if this hasn't been diagnosed and left untreated, those feelings go into our adulthood. And as they go into our adulthood, they go into how we choose relationships, how we deal with other life stressors and challenges that life brings. And so it's really important that we catch this as early as possible so that we can minimize a lot of those unfortunate feelings and thoughts. Okay, we'll look at this real quickly. We're looking at the behavior part of ADD, and this is what we would call an inhibition disorder. In other words, there's things that are written into the code of who we are that says this is right, this is wrong, this is how I should behave here, this is how I should act here, and so forth. For the ADD individual, again, we'll talk about children for the moment, to say they're struggling terribly, where we kind of looked at this concept of what's coming in and what's going out. So output is the issue, not input. So what they're seeing with the gathering for the environment, their ability to interpret that and put that out in the right way is often a difficulty for them. It's definitely a problem of persistent effort. Why try? Why keep doing this? What do I get from that? I've gotten scolded or, brought down, my grades are poor, whatever. It just doesn't seem like I should go on and keep working at this when it's so hard. And so it needs an individual needs a lot of coaching, a lot of attention and help in that issue. We also look at it in the deficiency in 4 executive disorders. Executive functions, I apologize. Our executive functions basically are our ability to initiate, to step out and do whatever the command is. So if I say to my son, go take the trash out, and he looks at me as if a deer in headlights and said, yeah, right, sure, I'll get it. No, I need to go do that right now. And the response should be, okay, Dad, I'll go do that right now, right? But for the ADD individual, it's 20 things that I do around taking the trash rather than doing the task that's at hand. So the ability to initiate, to get going, to get started, and to do the task is part of our executive function. The ability to sustain attention and keep that long enough to get your checkbook balanced, long enough to do the task, long enough to brush your teeth or whatever. Across the span, it's different for every individual. It's a lot of work to sustain attention and get that task done. The other function is to inhibit and shift my attention, So I did see somebody walk down the stairs not too long ago, and I did, out of the peripheral, look and see that, but my task at hand is to keep you engaged and keep talking about this important subject we're doing tonight. So a person that doesn't have that ability, they get lost. They're over here, again, doing other things besides what they need to do, and that, of course, gets them in trouble academically and otherwise. So we look at that real carefully, and we see that that the ability to process feelings and thoughts, ability to organize our behavior over time, be able to look to the future and see, how this is going to work out. Children love looking forward to something, and if it's something out here like after school, I get to go to the park and play. They're thinking about that all day long. All they can think about is, I got to get out of school, I got to go to play, I got to go to play. And everything else is lost because of one hyper thought that that's what I want to do today. And so it's hard to organize and keep in the here and now without being way out there. And children particularly, I had one child many years ago, beautiful little girl, and she had this habit of not telling the truth. She was very much a fantasy kind of thinker, and she kept thinking about all these wonderful things that children at 4 or 5 years old do, which is their magical thinking time of their life and development. And she was fantastic as creating some of the most phenomenal imaginations, especially when she was being corrected or needed to brush her teeth or needed to go to bed or whatever it was. And for her way of coping was always to create a story. There was always a story. So, why did you do that, Jane? Well, it's about, and then off we go into the imagined world. And that again is a frustration for parents because we're trying to do it here and now, and that child is not here with us right now. That's very much a part of that. So we're going to go ahead and move on. I'm just getting away very quickly. This is kind of a slide I'm just telling us again what the conflict is and how that really creates problems over time. So the deficient self-regulation, behavioral reaction, and good responses is just they don't know how to regulate. So in the middle of a situation, they can let out a laugh, can say something inappropriate, and certainly it affects mood, and it's probably very embarrassing along the way. Impaired ability to organize and plan behavior over time, we already talked about that. inability to direct behavior away from the present and towards the future. That's a challenge for them, and it has to be set down, structured, and planned out carefully. This is very, very important, this last one, for children, for adolescents, college age, and adults. The social issue is huge, and when I don't feel accepted and I don't feel connected, I'm going to do something to help me feel connected. And usually that something, unfortunately, turns into some very poor choices, and certainly over the span of time can be very, very problematic as far as the law goes, and keeping jobs, keeping relationships, and so forth. So our non-ADHD control comes in this way. When an impulse comes, whatever that may be, thought goes into play. I'm supposed to do this. This is the right thing to do right now. Should I not? And then I behave accordingly. For the ADD individual, it would be the impulse comes, I go with the impulse, whatever that may be. I get up out of my seat and I run to do, sharpen the pencil. I sharpen my pencil right now when it's time to be listening or time to be reading, etc. So the impulse comes, the behavior is present, and the thought comes later down the road. Like, why did you do that? Do what? I'm fine. Everything should be fine. No, you did this, and now you have to suffer the consequences. And that can be very, very much a problem in self-responsibility and acknowledging the wrong that may have been done. Okay, Sarah, we got just a few more minutes to try to run through these.
So we're just going to run through these basically with some things that we want to avoid as caretakers, parents, teachers, those of us in the role of authority figure role in an individual's life or significant other. Negative remarks or put downs, overstimulation, ignoring the person, or just believing the myth that oftentimes we ourselves believe, well, I can't do this. I don't know how many times my 12-year-old said that the first week of school, who also struggles with ADHD. I can't. And my role as mom is to believe that yes, you can, and to affirm that yes, you can. Unnecessary sugary foods and caffeine, becoming overly fatigued. I think that's a big one.
That's huge.
Yeah. Under challenging, again, goes along with the concept that we talked about earlier in terms of boredom that Rich talked about. We want to try to avoid that. And under structured activities.
So we go to the absolute, the things that must be done. Carrie, you want to?
Okay, so learning in structured environments, the opposite of unstructured, increased interest level of tasks by using novelty. A lot of creativity, which I find very interesting because oftentimes I think one of the strengths of an individual, at least what I see with ADHD, is they're often very creative people. So thriving with things that are creative. The presentation format. So that could look like perhaps instead of just speaking, trying to learn a task or teach a task auditorily, that might be something kinesthetic, like hands-on. Assign brief tasks and offer immediate feedback. So, for instance, my son might get bogged down if I'm giving him a sequence of three-step tasks, as opposed to giving him one and then offering him feedback about that, giving him another feedback and then another feedback, that sort of thing. Again, absolutes allow frequent and active participation. Schedule academic activities early in the morning. That goes along with the fatigue factor that seems to be a really big issue. Supplement verbal instruction with active participation, which I just touched on a moment ago. Have 2 sets of extra learning materials for educational settings, work, and home. I suspect that might go along with what Rich was talking about earlier in terms of just forgetting things.
It's in my locker, Mom. So we look at some organizational strategies, things that help along the way. We can, again, do a poll with you. You probably have a lot more that we could add to this, but here's a few things that you're very capable of reading, but the idea is the more organized and structured things are, the better the outcomes. Be careful in saying that because that doesn't work for everybody. So that's not a blanket absolute, but it's a good one, and it's an important one that as much as possible for ourselves as adults in our workplace, that we organize and keep things in such a way where we can get to them quickly, we can put them back, et cetera, how much better our day goes. I'd like to talk about self-reward systems. This is something that kind of goes along with what we do with children. We create a token economy kind of thing, you know, that we're building the reward, and you can see what the reward is. We talked about earlier, do it now, get a quick response. Well, reward is critical. Affirmation, verbally, physical touch are valuable, but sometimes that individual may need something like a token in their hand to say, I did it, I got it done, and I can feel good about it. The other things that we would want to at least look at right now is discuss behavior modification systems for use at home, work, and school. Not one behavior is always going to work in every situation. And so it takes a little bit of effort, especially for parents and educators, and if you supervise someone at work, to help create a lot of change that is something that keeps from boredom setting in, keeps things from becoming monotonous and overwhelming. And certainly in that way we can create better things for the individual. So those are some things that, again, that we would at least want to look at. And then I won't take time to go through the behavioral management. Those are things you can look at. Maybe just point out the positives before negatives. It is our nature by human being that we see the negative before we see the positive. It just is the way, unless you're really geared that way. You always think of the glass half full. Most of us are going to go to the negative before we go to the positive. So positives before negatives, rewards must be first established and must be powerful enough to balance punishment. So we want that child, particularly as children, to see, hey, I'm doing good, I'm doing good, I'm doing good. We just want to keep lifting that good thing again, because if all these things that we looked at a few minutes ago that are thoughts and feelings that are pretty negative, then we really need to teach and to implement those positive things. Okay, we've given you a lot of things to think about. We don't expect you to be therapists, we don't expect you to be doctors, and we certainly don't expect you to provide treatment. But hopefully the things that we talked about tonight will at least open your eyes to see, hey, this is truly a problem. It is a treatable problem, and therefore that gives hope to anyone who suffers with this or the loved ones who may suffer with this. We've tried to emphasize the positive part, which is saying, hey, you can do this. We believe in you. You can have a better life when you're doing things that make you feel valuable and valid as a person. So we're going to talk about treatment real quick before we go into questions. And treatments are really, really critical, and there are many, many different approaches. Tonight, Jenny Hayden is going to come up and tell you a little bit about her experience and what she's doing for her family. Could you? Thank you, Jenny, for coming tonight.
Good evening, and I just want to let you know that I have 3 children. The oldest is 16 and a half, and my youngest is 8. As far as genetics, my 8 and 9-year-old are biological. My 16-year-old is adopted, and he was ADHD, and both of my other children are ADD. And I suffered, and I'm going to say I suffered with my adopted son. I've had him since birth. It was such a challenge because getting him diagnosed, what's wrong, of course my insecurities as a parent because he was adopted. I fought the medications because it was just, it made him not himself. He was in 6th grade and weighed 60 pounds from some of the medications, and I won't name them, but I partnered up with a company that partners themselves with Princeton University that came out with a fantastic product that my kids are on. It's holistic and it's called ADHD. And I have left you some information on there about it. And right now, my children are thriving on it as far as for their ADD and ADHD. It actually prevented my daughter from going to summer school because she snapped right into shape. She was able to focus. So it's just other options out there. I'm not saying it's for every child. It's definitely something to research. And as a mother of 3 children that went into this, it is hard. And I will tell you that my biological children were accidents because Harrison was 7, my 6-year-old was 7 when the other 2 came along. We did not adopt again because of the ADHD. That's what really struggled with us. And it's an emotional roller coaster. So don't feel like you're out there like, oh my gosh, this is so crazy. 30 days, like, I don't know if I could get up and deal with this. It's just so hard. So as a parent, I've been there. And feel free to ask me any questions or call me and talk to me. So I guess like I've been dealing with this for about 12 years. So it's, you know, there is some normalcy at the end of the rainbow, I promise.
So our hats off to you, Jenny. Thank you for coming and sharing that with us. And these are really important things for you to know, that there are many, many approaches that are possible. And we try very hard to do a holistic approach so that we make sure that all parts of the individual are met as much as possible. So how do you treat? There is multiple approaches. Some people come in counseling first, some people go to jail first. How we do that, you know, depends upon the individual and their dynamics. But the best of best is if you think your child, your adolescent, maybe even an adult that you know, spouse or otherwise, family member, the best thing to do is go to your doctor and begin the process by ruling out that there's anything medical. Once the doctor rules that out, then they'll make a referral to us or to another agency that's doing this kind of work, and they will help. We help by doing a full psychological evaluation, which includes some very specific ADD questions and history that is beneficial for us. Once we know that, then we look at things like supplements, and then maybe even back to the doctor, what's going to be the best. The good news is, today, in our day right now, so much research has been done, so much good has happened in understanding brain anatomy, brain imaging, and so forth. A gentleman by the name of Dr. Daniel Amen has done phenomenal work in helping us to understand what really is going on in the brain. And if you look at it for an ADD individual who's not stimulated, the brain's asleep. For the person that is hyperactive, the brain is red. And when the brain's red, that's not a good thing because everything's overly stimulated. So we need to bring that stimulation down, believe it or not, by creating another stimulation to wake the brain up. And so our older medications, Ritalin, Adderall, well known, have now been in many ways replaced with the research that's been done to understand that this is also a norepinephrine issue along with dopamine. And so when those are being examined and treated, we are able now to be able to have alternatives to the stimulants, as well as being able to offer good alternatives with norepinephrine type medications. And that'd be like Vyvanse and Tuna, Strattera, and so forth. So the good news is there are many good options. And even if you are a person that says, well, sometime I just need a little bit to help me in some situations, like I'm doing a checkbook, or I'm preparing an important document or something like that. I really need to give fine-tuned attention to. we're able to give smaller doses of medication to help in those times, but of course with the diagnosis of inattentive ADD, so that that person doesn't have to be medicated all the time. And perhaps depression follows along with that. So if you're treated with Wellbutrin, for example, it's a very, very good medication to bring down some of that inattentiveness and help the individual bridge over some of the difficulties they may be having. So you get kind of a dual, better feeling with depression, better attention, hey, life is going good. So those are just some examples, many, many, many more. And as I said at the beginning, we are just really skimming the surface of this very complex disorder. But the good news is there is help and there's hope for treatment. And you coming out tonight is an example of saying, hey, we want to know more. How can we better educate ourselves? How can we help our loved ones? And even maybe it's a co-worker or somebody, it's a neighborhood, whatever that you see maybe struggling. After tonight, you have just a little bit more education, a little bit more knowledge to say, here's what your first step ought to be. And you don't have to suffer in silence or suffer a certain way. Well, thank you for coming. We want to ask if you have any questions before we wrap up. And if you need to leave at 7 o'clock, we certainly understand. Feel free to listen.
So I recognize the advantage or the opportunity if an adolescent has a diagnosis for accommodations or acceptance from other adults and understanding. Are there societal advantages to being diagnosed as an adult, like a 20-something or a 30-something-year-old? Is there a benefit there? Why do you recommend diagnosis at such a later stage?
Very good question. Why recommend a diagnosis at a later stage of life? Because the same problems get magnified over the course of time, be it legal, marital, relational, employment, so forth and so on. When nothing else seems to be answering the why, if we are able to sit with that person and help understand what's going on, there's treatment available and they don't have to go through life with many, many cascading problems. So left untreated, and it's significant enough to create these problems, here's part an answer to that. Very good question. Thank you. Others? Yes, ma'am.
Does your clinic have a psychiatrist?
We do not. We really wish we did, but we do not. So we have local psychiatry that we can refer to, and also further up north in Holland and Grand Rapids, we refer there as well. So we're happy to help you make that referral if necessary. Other questions? Yes, ma'am.
She said something about sugar and caffeine that should be avoided, right?
Yes.
So is there anything, because my son, for example, he has cerebral palsy, so he's in the group of the brain injury, and we still don't know if he has ADHD or not. We're trying to figure out. Is there anything that he should eat? Because like for him, I've heard that for cerebral palsy, omega-3 is really good for him. So I have been giving him this like since birth. Is there anything else that I should include?
Proteins are very important. So if you think of a snack, it's a good protein snack. Cheese sticks, fruit with peanut butter, things like that would be a good alternative. As long as it's not diabetic, you should be able to do well with proteins, because obviously, again, we don't want to ramp up the hyperactivity. We're just trying to feed the needs that the brain has. And proteins are very good.
Okay.
Great question. Thank you. Any other questions? Well, thank you for coming. Very nice to have you here this evening. And we'll